Leg ulcers. An ulcer is an unhealed sore or open wound that may appear on the skin or mucosal surfaces due to destruction of the epidermis that extends into the dermis and may reach subcutaneous fat or deeper tissues. A leg ulcer is an excavation of a skin surface. That occurs when inflamed necrotic tissue sloughs off. Arterial ulcer, also known as ischemic ulcers, are typically associated with peripheral artery disease, in which the ischemia is due to occlusion of an artery leading to the reduced blood flow to the tissue, leading to tissue necrosis and ulceration. Risk factors include diabetes, smoking, hypertension, and hyperlipidemia. All things that damage the arteries in general. Arterial ulcer often begin as minor wounds that fade to heal because the blood supply doesn't meet the increased demands of the healing tissue. The lesions are often dry and painful, but with little bleeding. Tend to occur on the tips of the toes or between toes, lateral side of the leg, and over bony prominences, such as on first or fifth metatarsal head, or pressure areas like the heel, malleoli, and shin. Often there's a shiny appearance to the skin, local hair loss, diminished pulses, brittle or rigid nails, and the ulcers sometimes get infected. Non-healing ulcers may progress to dry gangrene. Venous ulcers are associated with venous insufficiency due to valve dysfunction, which causes stasis of blood in the legs, and that leads to an increased venous pressure. This in turn allows blood proteins and fluid to leak into the interstitial space. Over time, this increases the pressure in the tissues and can cause tiny capillaries to get pinched shut, ultimately leading into tissue ischemia and subsequent breakdown of the tissues, including the skin. Some risk factors are being older, female, obese, pregnant, and standing for a prolonged period of time. Venous ulcers are usually shallow with irregular borders and overlying yellow fibrinous exudate. They're usually on the lower leg, on the gaiter area of the leg, which extends from the mid-calf to ankle on the medial side of the leg, around the medial malleolus, and they can cause mild to moderate pain. There may be associated signs like edema, varicose veins, and brown discoloration of the lower legs and feet due to hemosiderin deposition. There may also be stasis dermatitis or lipodermatosclerosis, which is erythematous, induration, and fibrosis of the lower medial leg, which can also be painful. The history of the condition is important in determining venous and arterial insufficiency. The pulses of the lower extremities are carefully examined. The diagnostics and the culture are to determine whether the infecting agent is the primary cause of the ulcer. The general approach to treating any ulcer starts from wound debridement to remove the accumulation of devitalized tissue, as well as decreasing the bacterial load to prevent infections. This is usually done through irrigation, typically warm isotonic saline solution, while surgical debridement with a scalpel or other sharp instruments is done for removing large areas of necrotic tissue. For chronic non-healing ulcers, or when there are signs of infection, antibiotic therapy is prescribed when the ulcer is infected. The specific antibiotic is selected on the basis of culture and sensitivity test results. Oral antibiotics usually are prescribed because topical antibiotics have not proven to be effective for leg ulcers. Different methods. Topical therapy. Wound dressing. Stimulated healing. Nursing management. Promote adequate nutrition. Good nursing hygiene. Positioning of the legs. If there is an arterial insufficiency, the patient should be referred to be evaluated for vascular reconstruction. There is venous insufficiency. Dependent edema can be avoided by elevating the lower extremities. Protective boots may be used. They are soft and provide warmth and protection from injury. Heat increases the oxygen demands and thus the blood flow demands of the tissue, which in this case are already compromised. When infection resolves and healing begins, ambulation should resume gradually and progressively.